So, hi Miriam, how are you? And before we get stuck in, I just want to thank you so much for coming on today and sharing your cancer journey with everyone and all of our listeners. And just before we get stuck in, can you tell us a bit about your life before cancer? What age you were when you were diagnosed, just before it, and what was life like for you then?
Sure, and thanks for having me on, Vanessa. It's great to be on
Oh,
the
no, we're
podcast
delighted.
today.
Yeah.
So I was 45 when I was diagnosed, and I was just kind of reflecting on it today before I jumped on the call with you.
Yeah.
Like I was at my fittest. I had just completed my third Ironman triathlon.
Wow.
Um, and I had a personal best time and that. Like I had never been fitter and healthier. I
Yeah.
was I have 3 children, I had a full-time job, so I was like, and still am, a very busy person, like, I love to be busy.
Yeah.
But, one morning, I was out with a friend of mine for a bike ride, and we were stopped at a traffic lights, and I kind of felt something in my armpit, like, I put my and my
Yeah.
armpit was, like, down, and I put my finger in, and I could feel a lump. I was like, "Oh my god, that is big," like, I could feel a large lump. Now I had no pain. I had no symptoms up to this.
Yeah.
So, like, I'm pretty proactive. So it's like straight away next week, I went to see my GP who referred me to the breast clinic in James's. And I went in there, had a mammogram. Mammogram was clear, ultrasound of my lymph nodes, and there's like a 2.5 centimeter mass on my lymph nodes. And I remember the sonographer kind of saying, "Look, we need to biopsy this, but even if it's benign, this needs to kind of come out." That was the sort of indication.
Yeah.
Early on there, I was kind of thinking, "Oh, this doesn't sound great," and but it was a long time coming back because they biopsied it. But first of all, it was, if you remember back to that time, it was actually the beast of the East.
Yeah.
So there was a lot of disruption to people getting to work. Everything was disrupted. And I guess, they biopsied it looking for breast cancer. That's what they thought it was. And it wasn't breast cancer.
Okay. Yeah. That's what I was going to say to you. So, like, you had no idea what it was at all.
No, I didn't. No. Um, I got a call to go into the breast clinic and I was seen by the surgeon there, and he said to me, "This is melanoma. This is not breast cancer." And he had a cursory kind of look at my skin to see if there was anything on it. There was nothing really obvious. But he said, he actually said to me, "This is melanoma. There's nothing I can do for you. You need to go to dermatology." And he walked out. And that was how my cancer diagnosis was delivered.
Wow. So he just literally walked in and told you, and then
Yeah,
said it,
told me it was
it's
something else and told me there was nothing he could do, and then his parting shot was, judging by its size, it's been there for quite some time. So, there was a CNS clinical nurse specialist there with me, and she was frantically trying to clean up the kind of mess that he'd created and
of
said, "Look,
course.
I have booked you in for a scan. I've requested an appointment with dermatology." Like, she was kind of saving grace because I
Yeah.
just felt like, whew, it was
What's
very
happening?
what's happening exactly.
Yeah.
And from then it was kind of a whirlwind because I am actually, there's about 5% of cases like mine where there is no primary source on your skin. There was no
Okay.
lesion on my skin, so I had nothing to kind of indicate that I had melanoma, which is normally a skin cancer, cutaneous melanoma.
Yeah.
So I had to have a lot of investigations then to see where it might be. So I had like a lot of skin investigations, but then melanoma can also form in the eye. It can also form in this kind of mucosal tissues of the mouth, the genitals. It
Wow.
can be in your kind of GI tract. So I had to have lots of scopes, visit an ophthalmologist, etc., to
Yeah.
rule out other sources of primary. So my final diagnosis was a stage 3 melanoma with no known primary, but it was a cutaneous skin melanoma, which is so the theory there, they don't know for sure, is that maybe there was something on my skin at one point and it healed up but remained in my system, so that the immune system may have dealt with it on the skin. They don't really know why unknown primaries come about.
So, like, it is obviously a form of skin cancer, like that. And would you been person that wouldn't have wore sun protection? Would you been out with sunbathes? I doubt it.
Well, I did, yeah, I guess, I mean, I grew up in the 80s, right, in Ireland, so sunscreen wasn't a thing. I
Yeah,
have red hair, so I was sunburnt multiple times as a child. That was just standard
yeah.
summer stuff for us. Now, we wouldn't have really done overseas holidays. I never did sunbeds or anything like that, but yes, I would have had regular sunburns as a child.
Sure, everyone did.
Yeah.
Yeah. Do you know, back then we used to be threw out to the bog.
Yeah, and
The
it was a
worst
thing that
place.
like a bit of color was seen as a good thing.
Yeah, yeah,
And there was less understanding of the dangers of it, I guess. And then I'm a triathlete. I was all,
yeah.
I'm an outdoorsy person.
Very healthy.
Yeah, but in my adulthood, like, would have been quite careful with my skin, but certainly in my childhood, right through my teenage years, like, I would have got regularly sunburnt.
And how did you feel, Miriam, when you heard those words? Like, and you're so young as well, and just not
Yeah, I mean,
expecting it
you
out of
don't
the
expect,
blue.
yeah, but I think, I think that's the same for most cancer, but no, does anybody really expect it? I'm
Yeah,
sure people do. And, this it was an awful shock, and I think
yeah,
cancer diagnosis is always an awful shock. For me, I really went to the kind of worst case scenarios thinking, "Oh my god, I'm going to be leaving my children behind," and
yeah.
that's really, like, I remember having conversations with my husband to say, "You better love those children, enough for both of us," type thing.
Yeah, of
But
course.
I kinda needed to go to that point in my head to kinda say, "Okay, well, that's if that's the worst case, which, and that's manageable, then, like, everything's kind of a bonus from there." Kind of a weird way
Yeah, of
to approach it, but that's kind of the way I dealt with it.
course. And what age were your kids when you
So
were
my kids
diagnosed?
were about 15, 13 and 10.
Okay, yeah,
So the older two, I think really they kind of got it. The youngest fella, I don't think, I think a lot of it passed him by a little bit. He was maybe a little bit too young to understand
yeah,
it. We didn't share a huge amount. Like we said, okay, I didn't tell them until after I had a treatment plan in place. And then I said, look, I've had this diagnosis. This is what's going to happen. And then I'm going to get this treatment and we'll go back to normal type thing. I very much treated it on a need to know basis because I
you
think
didn't want to frighten them, of
didn't want to
course.
frighten them, and I
Yeah,
think, like, until there's a plan, there's not really any point.
yeah,
It's hard enough waiting for a plan as an adult for your own self, but, like, putting that additional worry on kids where they don't know what's happening, I think is not it wasn't for me, so that's the
no,
way I handled it, yeah. But my focus was really around my kids, like,
yeah, of
yeah,
course.
yeah,
And plus, like being so fit and healthy and, being out and feeling this lump one day, and then next thing your world is just turned
yeah.
upside down.
It's just
Like
like the
just the
rug being pulled out
impact.
from under you, like, it's just,
Yeah,
yeah, it really is, and I think quite a lot of me went into denial, like, I went back to
yeah.
work, I just went in, just
Keep going.
keep going, ignore it, which,
Deal with and that's kind of normal, isn't it? You're kind of through into this autopilot where you're kind of appointments after appointments and
and I think it's not a
just
bad strategy, denial, like,
yeah,
because, you have very little control realistically at that stage, in the early stages, you need to just do what you're told to do by your treatment team.
yeah,
So I
exactly.
think whatever kind of gets you through that mentally is, whatever works for you. So I wouldn't I think denial's fine to use.
Yeah, girls listening, men, denial's fine. Say
Well,
go for
denial's
it.
fine once you get treatment plan, but like, if there's a symptom or something you're concerned about, denial is a bad strategy, right? Yeah, yeah,
Course, yeah. Always listen to your body. You
yes,
learn to, you listen you become so cautious of
you
everything,
do,
don't
yeah.
you? But Miriam, just when you got all that and you were told it was stage 3, you obviously got the test and everything to know that it didn't spread anywhere else in the body, which was great. So talk us through what exactly is the treatment plan then, and how long did it last? And
So at that point in time, the treatment plan was surgery, so removal of lymph nodes, complete lymph node dissection. And there was an option for local radiation, so radiation to the lymph node site. And that was to kind of prevent any local recurrence in that area. So if there was stray cells left after the
Yeah.
surgery, they'd be cleaned up. So that's what I had. Now, that's all that was available in this country at the time, and we'll probably get to this discussion later. In
Yeah.
other countries and with other cancers, you have like adjuvant treatment, so after surgery, some, systemic treatment to kind of belt and braces to ensure
Yeah.
that it doesn't kind of return. That wasn't available in melanoma at the time. So I went on to a surveillance program because the stats for my kind of cancer, the stage I was at, it was about a 70% chance it was going to come back. It was
Oh, wow.
quite high.
Yeah.
Now,
Yeah.
again, I was in full denial. I'm completely in the 30%. This is not going to happen to me.
Yeah.
Like, I went back to my normal life. um and I really, like, almost had myself fully convinced, that it was
Oh,
not going to come back. Like, I remember then a year later, so I was scanned 3 monthly, and I'd had so few scans where everything was fine, so that was great. But I remember going in to get the results on the scan in a year later, so it was around January of 2019, and I was kind of annoyed because I saw the oncologist had taken my file. He'd gone into his office, and I was still waiting to be called, like 10, 15 minutes later. And I was like, what is he doing? Like, I've got stuff to do.
yeah, I'm too busy. Come
I
on.
didn't read, it's only afterwards I twigged, like, he was reading my results and going, oh crap, I'm going to have to deliver this news to her, which is
Yeah.
good news. I was there going, when is he going to, I've got stuff to be doing. But like, so then when I went in and he told me that it had metastasized to my liver, I was,
Wow.
I, that was a sucker punch. Like, I really thought,
Yeah.
I'm toast here. Like, that's it,
And were
stage.
you on your own?
I was on my own.
Yeah, because you weren't expecting this
I wasn't
news.
expecting
Yeah.
it, no. And,
Just
so
out of
yeah,
nowhere.
it
A
was,
year.
yeah, yeah, a year later turned up my liver, which, again, knowing what I know now, that's probably not hugely surprising. Like, I'd say
Yeah.
it wasn't a huge surprise to the oncologist. I had myself so fully convinced it wasn't going to happen that it was a total shock to me.
Yeah.
So ironically then, because I'd progressed in a stage, it opened up treatment options to me, which weren't available to me at stage 3.
Right.
So
Okay.
I remember him saying to me, you know, "It's not without hope." He goes, "I have patients walk out of here after 2 years cured. The situation is not without hope." That's what he said.
That's for stage 4 that people
Stage
have walked.
4
Oh, brilliant.
melanoma. There's
And
about
that's a very scary word, isn't it, when
It
people hear
is.
that? They
Yeah.
think, you know.
Yeah. And it is scary. Like, there's no question. These are life-changing diagnoses. Like,
Yeah.
but what he was saying is, and versus even only kind of 3 or 4 years prior to that, there were no treatment options available for my cancer. Like, they were very new treatments that
Okay.
were coming out. So I was lucky in that sense. Like, if I'd been diagnosed kind of 5 years earlier, my chances would have been significantly lower, like
Isn't that just
5%.
awful to think of,
Yeah,
you know?
yeah. So,
Jeez. So
so
after
then
that
I
then, yeah.
started on that treatment, which was a combination immunotherapy treatment. And the kind of protocol for it is you get 4 doses of this combination treatment, and then you move on to a single agent after those 4 doses.
All
The
right.
4 doses the combination treatment is quite toxic. So lots of people have side effects. Lots of people don't make it through all 4 doses.
And what are the side effects? Are they just
They're mainly kind of inflammation related. So what the immunotherapy does is it kind of takes the brakes off your immune system. So you can get a lot of odd reactions. So they're very different to chemo side effects.
yeah.
So it's stuff like inflammation of various parts of the body. Like, the most common ones are kind of the gastrointestinal tract. So like diarrhea,
Yeah.
vomiting.
Very painful.
Yeah, and very debilitating. Like, you may have to be hospitalized because you literally cannot keep anything in your system. A lot of skin reactions, a lot of immune system reactions, which is what I had.
Yeah.
Um, so I had 3 doses of the combination treatment, and then I had a fairly spectacular side effect of adrenal failure, which is one of your kind of hormone producing agents in your system. It produces adrenaline and other hormones which help keep your body's salts in balance, right? So your kind of all your potassium, sodium, all of those in balance. And
Yeah.
so
Extremely important.
yeah, extremely important.
Yeah.
We ended up with and possibly because I'd been so fit and well, I kind of ignored a lot of the side effects. I was feeling really kind of unwell, like nauseous, off my food, tired. But I'm
Yeah.
like, yeah, but you're on treatment, like, that's normal. I didn't feel.
Yeah.
But then I crashed, like I crashed, and I ended up in James's ICU
Wow.
and in hospital for like 2 weeks with adrenal failure, which is it's an autoimmune disease which I will have for the rest of my life now. But I can manage that with
Yeah.
medication. But yes, that was fairly catastrophic side effect. So then I had to pause my treatment for a while and go back onto just the single agent, which I started back. That was 2019. I progressed. April of 2019, ended up in ICU, and then I started back in treatment around June or so.
Okay.
And then October, on a regular scan, it picks up that the lesion on my liver is growing again. So it had kind of stopped growing. It was kind of the immunotherapy seemed to have stalled it, and no new sites of disease, which is great news. But this started to grow again. So my oncologist made a decision to stop the treatment and spot treat that lesion with radiation. So I went off and had stereotactic radiation, which is very highly
Targeted. Yeah.
targeted to my liver. And that was around December of 2021. And in April of 2019, that was in April of 2020. So just as the pandemic was wreaking chaos, I
Yeah.
went in to have a scan and I had no evidence of disease. And
Wow.
that was April 2020, and my most recent scan, which is May of this year, 2025, I still have no evidence of disease for 5 years with no.
Wow.
So,
Hey, that's a big celebration. Wow.
yes, like it's kind of a long.
You've
Uh,
been through the wars.
but yeah,
Yeah. You've been
I
through the
have, but
wars
I've
with it.
also been lucky. I have been
Yeah.
lucky. I mean, the 50% of people that the treatment works for, it works for about half of stage 4 patients. And I'm in that lucky half, and
Yeah.
they don't really know why it works for some people and not for others. Still trying to kind of figure that out.
And I'm sure
Yeah.
you've met people on your journey that it hasn't worked for. Like,
Yeah,
it's very
it
heartbreaking,
is,
you know?
yeah. And I guess that's part of the whole, the bonus, I would say, of cancer. You meet so many amazing people, and I always call them like my cancer friends, but like,
Yeah.
you do lose cancer friends as well, which is really hard and
Hard.
hits home. It hits
Yeah.
It's very close to home, I think.
Yeah, I've lost a few myself and it's just so heartbreaking,
Yeah.
you know. But at the same time, I look back at it and go, but I would never have missed out on meeting that person
Yes.
either. You know, you have to kind of weigh it up that way.
Yeah.
So basically, you're all fit and healthy now, which is great.
I mean, I think I still do a lot of training and triathlon, but my cardiovascular system has not really recovered from it. Like, so, but I would say, like, I take part now. I don't compete anymore, but I still take part, and it's still a big part of my life. And it's really, helped. I would say, like, training
Yeah,
really helped me manage my mental health
I
during.
was just going to say that. Yeah. Like, I'm sure there's still days where you have, bad days, like
Yeah.
everyone, you go up and down and stuff. And I suppose you're always kind of living like scan after scan. So
Yeah.
that on its own is a lot of stress and anxiety, isn't
Yeah.
it?
And I found that training really helps me with that. It's like a constant. I think it's that connection to my old self, and also, you know,
Yeah.
still that your body can still do like amazing stuff. And, it's kind of, and also, I have a lot of friends in there, you can just go out and forget about cancer for a while, like, 'cause you're
Yeah.
focusing on, getting up the hill or making that time or the next lap in the pool or whatever. Like, it's a total disconnect. It's a mental switch off from
Yeah.
because cancer can take over your life, like can take over your
Absolutely. And it's so important to make time and separate it. Like I always say, it's a chapter, it's a big chapter,
yeah.
but don't keep rereading it. I know for stage 4, you have to go back and check it every now and then.
Yes.
But other than that, leave it closed.
Yeah, and it's nice to free your brain from thinking about it from time to time, particularly
Yeah.
in those really stressful periods where it's really on your mind. Sometimes just going out and physical exercise, like
Yeah.
it really helps release that stress.
And what advice would you give to people that are listening that are starting out, that have started on their cancer journey?
Well, I think, to find what works for you. So I would don't deny yourself the
Mm,
moments of joy, So if,
yeah.
like training was a big thing for me. It's not for everybody, but like I am a big advocate for, I think exercise of any type helps, right? Getting out in the fresh air, being with your friends, social, like
Yeah.
connections.
Yeah.
And, one of my kind of mantras was like live every day. Like, none
As
of
if
us
it's
are
your
kind
last nearly.
yeah,
Yeah.
like just and appreciate
Yeah.
the smaller
Cancer or
things.
not, you're not guaranteed tomorrow. No one is.
Exactly, yeah. Yeah, exactly. And I think that like that's I guess one of the as I say to my friends, there's not many benefits from cancer, but some of the things that like it does focus your mind on what's important and cut out the bullshit, like, and just focus on the important things to you. So don't deny yourself those little moments of joy, like, and everything in moderation. Sometimes cancer patients there's a lot of guilt laid on them about
Yeah.
what they should be doing and what they've done to cause their own diagnosis. And I think people can say awful things to you and they mightn't mean it. You know what I mean? They mightn't mean
They
what
don't
they're
know what to
saying.
say in a way,
Yeah.
you know?
Yeah.
Yeah, absolutely. I've so many crazy stuff people would say to you, like, "Oh, you don't look sick," or "Oh,
Yeah.
you got the good type of cancer."
Yeah.
It's like,
And I
no,
think
not
every
really.
cancer has it's like there's stigmas that are attached to many cancers, like
Yeah.
I know a lot of my friends in lung would say, people always ask them like, do they smoke? People
Yeah.
ask me like, oh, did you use the sunbeds? And it's
I
like,
usually do.
but
Did
like
you use sun cream, Miriam?
I think it's the human nature where the person who is found out, right, you have a diagnosis and they're frightened by it. And they're saying,
Yeah.
oh, well, I didn't do this, so I'm okay. And the
Yeah,
reality is, most of the time, yes, there are contributing factors, but a lot of the time it's bad luck. It's
it
just
is.
bad luck. And life isn't fair and that's bad luck, and there's nothing.
But your cancer affects is 1 and 2 now,
Yeah, yeah.
which is crazy. But also after that, which I think is amazing what you've done, you started UCAN. Tell us about that, which is wow. When you're inspired by someone who's went through the journey and how you've created that to help others, it's so inspiring. And please tell us all about it.
Oh,
Yeah, it's
thanks, Vanessa.
great.
Yeah, I mean, I think again, it's been something that's been very gradual for me. It's been a journey like into cancer along this path. So, like,
Yeah,
I would have started out very much within the melanoma support group. One of the women who runs that said to me, she obviously saw me coming in, and I must have been a
yeah,
bit vocal or whatever, but she kind of asked me to help her run it. So I was helping her run it. Then gradually got involved in the European Network for Melanoma support. So there's a Melanoma Patient Network Europe, which is a very strong advocacy group, actually. And they invited me to some of their training, right? So that gradually kind of awakened my interest to go, oh, yeah, there's actually systemic issues here, looking at a broader picture. And then I guess because I was more well myself, right? So I was
yeah.
less worried about myself and more thinking, oh, what
How
could
can
I
I
bring
help?
here? Yeah.
Yeah.
So I kind of gradually, like, as I got more knowledge, then thinking, that's not right. This isn't right. We should be. And one of the things we worked on within Melanoma Support Ireland was canvassing and advocating for stage 3 access to these drugs. So this was
Before it gets to stage 4. Yeah.
exactly. So
Yeah.
in my case, so we did a campaign. This is going back in 2019. So, and this was the start of this public-private issue that we have now. Back in 2019, VHI announced that they were going to fund treatment for their patients, for their customers who had my diagnosis, right? So, like, shortly after I progressed to stage 4, they opened this up for their patients. And in my naivety at the time, I thought, oh, the state is going to follow suit now. They're going to say, they're going to be embarrassed into it, right? They're going to say,
Yeah,
oh, the VHI are doing it. Maybe we should be doing it as well. But no, they didn't. And
they didn't.
actually, it was 2 full years later before the state stepped up to the mark and approved it.
And when you think of that 2 years, how many
How
other
many
people
patients?
could have been
Yeah.
saved, you
Yeah, and
know?
it's just like, so, if you get it at stage 3, if you get the treatment at stage 3, first of all, you don't have the double agent, which I mentioned earlier, right? So it's
Yeah,
a less toxic treatment for the patient. So you only get a year's worth of immunotherapy because it's in adjuvant status rather than metastatic. So there's half the treatment, less toxic. So much less cost to the individual, right? Obviously, there's more people because not everybody progresses to stage 4, but
yeah,
70% it. Um,
very high,
so
yeah.
way high, so you're going, this doesn't seem to make sense. Like, how can this make financial sense, financially even, let alone moral, the moral
Yeah,
of allowing people. It runs counter to everything you know about cancer, which is catch it early, treat it early. You know,
yeah,
we're actually letting people progress to a metastatic state before treating it. It doesn't make sense.
doesn't make sense at
No,
all,
it
no.
doesn't make sense. So
It's like
that kind of,
burning money. Yeah,
yeah, that's kind of started me down that path of advocacy. And then I joined with Cancer Trials Ireland to try and really primarily to advocate for bringing trials here, because I thought we're never going to fix drug access, but patients can access drugs
yeah,
through trials earlier. I thought this might be a better way. And it is certainly one tool that we have. But Cancer Trials Ireland have a very good PPI program and a very good network. And I met loads of other advocates there.
yeah,
And then I would meet these people regularly at events and conferences and stuff. Myself and a couple of the UCAN team were at the now UCAN team were at a conference or an education session run by Breakthrough Cancer on immunology, right? So they had the guy
yeah.
who invented my drug was coming to speak. So I was like, I
Wow.
need to see this guy. This guy saved my life.
Shake his hand, yeah.
Exactly. I mean, it was really like fangirling, you know what I mean? I was like, he won the Nobel Prize, he's an incredible scientist. And we were in the audience and we're like, we should really formalize this network, And I remember after that, like sending out a group text to the numbers I had, you know, and I had actually called it Panic, which was like, um, patient advocate network in Ireland on cancer, right? And but it was a joke. It was tongue in cheek.
Yeah, yeah.
But that was the start of it, and we grew. Like a lot of the people who were on that original WhatsApp, then maybe invited in. Oh, I know this advocate who's working in pancreatic, or I know this advocate who's working in lung, and
Yeah,
it kind of grew. And then we started meeting regularly and really kind of thrashing out what are we about, and what we came out with was like, we're really about focusing on like the key systemic issues in cancer care delivery. And we discussed it for probably the guts of 6 months before we launched, but exactly how, are we like activists? Are we going to be at the gates of the Dáil? Like, or are we,
yeah.
advocates who are just kind of advising, and we're kind of
Well,
landed
you're
somewhere.
speaking up for the people,
Yeah.
which is what,
And that's
yeah,
what we kind of landed with. We want to make policy change. So we want to be the voice for patients, because
yeah,
we're looking back at our own experiences and going, you don't know when you're at diagnosis. You know nothing about your
no,
disease, and you need people who have gone before you to say, we know this, we've been through this. Here's how this could be made better, and speaking up on your behalf. Because when you're sick, when you're in the appointments, as you know yourself,
yeah.
it's really difficult. You can only focus on like getting through the day.
I was just going to say,
Yeah,
yeah, it's literally day by day.
it's
You
day by
don't
day.
come into that, but it's amazing what you've done and to come together. It's like you said, you're stronger together. That's your
Yes,
kind of tagline that you're using, which is a
100%.
group of you that have gone through all different types of cancer coming together and being one voice and standing strong and, letting people know that change needs to happen. And I'm in awe of you. I'm actually getting shivers here talking about it. It's just, how far you've come already on it
Yeah,
and getting out there and educating and
we're really
basically
so happy
standing
with
up.
that.
Yeah,
Yeah, we're
standing up.
very happy with how much impact we've already had. But I think because like cancer is a very complex disease, and
Yeah,
it can be difficult to understand where the issues are, and it can get very kind of technical. So I think, we are always like focused on patient experience, like what
yeah,
this is actually going to mean for patients, and simplifying it down because when we originally raised the issue of, lack of access to innovative treatments in this country, and how slow we are at getting them, and that kind of public-private divide, so many people came to us and said, I didn't know this. I didn't know. I thought once, you got diagnosed and you were in the system, it was pretty good here. And like, it is pretty good to a certain extent.
be a lot
There's
better.
but there's lots of things, like we are not getting best in class treatments. This is in the public system. In the private system, you will get access mostly to the latest treatments,
Which is unfair,
which is immoral, right?
Yeah, exactly.
It's not right. And now we're also seeing that with our population growth, actual delivery of treatment is going to become an issue. So I know I met you at Croke Park
Yeah, the
when we
All
were
Ireland
talking the All
Cancer.
Ireland Cancer Summit, but Dr. Michael McCarthy raised at one of the sessions there that in Galway at the moment, once a treatment plan is agreed, so if you go in, you get diagnosed and you've got whatever X cancer, and they say, okay, we need to start you on this chemotherapy. The first available slot for chemotherapy is 7 weeks away. So that's how overcrowded it is.
Yeah.
And
And a
so,
lot can happen in 7 weeks when it
yeah,
comes
and
to
like
cancer.
you will know as I do, the minute you
Yeah.
get your plan, you're like, I want to start
Oh,
now. I want
yeah.
I
Yeah.
want this cancer gone. I want to be
Yeah.
doing something about it. To be told you have to wait nearly 2 months to start your treatment, I think I would have gone off my rocker.
But some people are actually waiting longer that I've heard. Some people are like 3 or 4 months before they
Yeah,
start
and
their
that's
treatment.
just so wrong.
Like it's
It
terrifying to
is
be going
terrifying.
around with that.
Yeah.
But what you guys are doing is just great and, standing up for the people and trying to get, equal VHI, private, not private.
Yeah.
Everyone should have the same. Everyone deserves quality of life, isn't it?
Yeah,
And
and it's
that's what
like,
you're doing.
I feel, we're a rich country. Like, there's
Very.
no
Yeah.
really excuse for us, to be saying, oh, we couldn't afford this. And it's like, we can afford lots of things, and
Yeah, yeah.
so I do think it's important to keep shining a light on that because
Yeah. And what was your biggest win from it?
from with the UK, with you.
Yeah. What was the biggest yes moment, where you're kind of like, okay, this hard work and teamwork coming together, we're actually
Yeah,
finally
I mean, I
seeing
think.
something.
Well, our biggest win is yet to come. So if she's listening,
Okay.
we would love to get an
Yeah.
audience with the minister.
Yeah.
But yes, we've had
Absolutely.
some super support from TDs, and I think in particular I'd like to call out Paudie O'Sullivan, TD from Cork, who's been
Yeah.
so supportive of us and has been supportive of this issue prior to UCAN being formed. We've had some unbelievable support from clinicians as well. And it's so difficult for them as well
Yeah.
because they're facing patients every day, and
Yeah, of
knowing that they
course.
can't offer best treatment to patients is heartbreaking. And it's not why people go into medicine. So I think seeing that there's so much support for this change
Yeah.
is fantastic. And we
I'll
just
definitely be putting it. My app's coming out soon, and I'm
yeah,
going to be having it there for anyone to
super.
go on and to educate yourself. And that's the key to it, isn't it, Murray? Like
Exactly,
just
yeah.
educate yourself as much as you can and research what's out there and what is available.
Yeah,
You know,
I think while it's great advice, it's very difficult to do when
hard.
you're new to the
Yeah.
disease because the information can be frightening, it can be overloading. So I think, like I would say, reach out to your relevant support organisation. So like for melanoma, best
Yeah.
place to get us is on Facebook, Melanoma Support Ireland. It's a closed group, so you have to request access because we keep it a private safe space for patients, but like to reach out to say melanoma or Pancreatic Cancer Ireland or the lung cancer community, or because there is your community of people who have trod that path before you, and
Exactly.
they
Yeah.
can they can short and they can put the arm around the shoulder and say, look, it's going to be okay.
Yeah.
I'm living proof that you can get through this. So
Yeah.
I think that's very comforting for people at diagnosis and when they progress a stage to know other people have been there before them.
Yeah, 100%. And what would you say to yourself at to be looking at you now and when you first diagnosed? I always find this
Yeah,
interesting.
I mean, I think it's
What?
probably that it is. It's all going to be okay, and
Yeah.
whatever news you get, you will deal with it, and it mightn't be great news, and you might want to deal with it, but you kind of, um, it's a little bit like you have no choice. It's going to be okay, but I think, and as well, what I would always be saying to somebody else who's newly diagnosed is really listen to your body. I think for people, maybe this is a stage 4 thing. Like once you've got to stage 4, it's know that this can happen. Like you can progress, but your best tool is your own self surveillance. Like that is
All day.
really, yeah.
Yeah.
If you don't feel something's right, you're probably you're your best advocate. Like, and to not
Yeah.
let it go.
And
Yeah.
there's a lot of people there like, oh, I don't want to be like annoying the doctors or annoying them even a few years out. Absolutely not. Go and get everything checked,
100%, yeah. And
Don't be
I always
doubting it.
say, if someone comes onto the group to say, I have this on my skin, or I'm like, if you're asking here, you're worried enough to go to the doctor. Like, I
Yeah.
would never tell somebody who asks, oh no, that looks fine, because
Yeah,
I
of
think if
course.
somebody is worried enough to be posting in a WhatsApp or a Facebook group, then really you should set your mind at rest and go and see the
Go.
doctor. Yeah. Yeah.
100%. Absolutely. But listen, I just want to thank you so much for coming on and telling your story and being so open and honest about it. And just like what I said, this podcast is all about letting people know, it is hard. It's very hard. But we get out the other side, don't we?
We
And
do, yeah.
we
There
come
is
through it.
there is life after cancer, and I think,
Exactly.
yeah, it's for me, I've certainly like I've had a career change and all that, so
Yeah,
it hasn't been not all negative. There's been a lot of positives in it.
exactly.
So
And
yeah,
what you're doing is phenomenal and helping so many people. So thank you for coming on and sharing that. And on that note, we'll say goodbye to everyone and I will talk to you very soon.
thanks a million,
Just,
Vanessa.
I'm
Cheers.
just, no worries. I'm just going to stop this for a second.